Researchers at Oxford University say only 13% of the world's population is now fully vaccinated. And the numbers, which are compiled for all world in data, show they live disproportionately in the West. Look at that very clearly. The darker the green, the higher the level of vaccination. Around 44% of the people in the EU are fully vaccinated, and this is despite a slow rollout. In the US, that number is closer to 50%. Look down in Africa, 1.5% of the total population has received the necessary doses. The numbers tell half the story, but anecdotally, if you walk around, you see how real it is. For instance, in New York, the inequality is for anyone to see. Anyone who lives in New York can easily get a shot at multiple sites across the city. Wherever you look, there is a sign showing that you can get a vaccination shot. Even in railway stations like Penn Station, every pharmacy now, there is vaccine coming out of your nostrils. There's so much of it here. Get your free vaccine today. Now, compare this. Johannesburg, earlier this month. People queuing to get vaccinated as supplies remain scarce. You can't actually show a picture, of course, of no vaccine because there's nothing to show. Ngozi Okonjo-Iweala is the Director General of the WTO, World Trade Organization. She joins me from Geneva. She joins me via Skype. Ngozi, we'll talk about the G20 in a second. Pfizer opening in Africa is welcome. It begs the question, what took them so long?
Well, very good to talk to you, Richard. Let's say that we're all very happy with the Pfizer announcement, which came today. Actually, since it's now public, it was during a meeting here at the WTO where we assembled manufacturers that the announcement came. I think that if you talk to manufacturers, they'll talk about the difficulties they've had with access to raw materials and supplies, difficulties with supply chains, difficulties finding partners. These are some of the reasons they give. Vaccines are very difficult to manufacture, and you need to find quality partners. But that being said, I think this would have been good had it happened faster and sooner. Some vaccine companies like AstraZeneca, J&J reached out earlier and established manufacturing partnerships in different parts of the developing world. But anyway, Johnson & Johnson did that in South Africa with Aspen. So we are now happy that Pfizer is doing the same.
The G20 is calling a high-level panel, calling for greater investment. You will forgive me if I didn't waste too much time reading about the high-level panel's recommendations, because the G7 couldn't even get to 1 billion doses, and the G20 doesn't look like it's going to be able to move the needle much further.
Well, the G20 finance ministers actually convened this high-level independent panel to look at how we finance the next pandemic. And I was the co-chair along with Tharman Shanmugaratnam, the senior minister and former finance minister of Singapore, and Larry Summers. And we presented a report to the G20 finance ministers meeting in Venice 2 weekends, last weekend actually. And this report talks about 4 major gaps in global pandemic preparedness and prevention. The first is just a gap in global surveillance and research. Second, in resilient national systems. Third, supply of medical countermeasures. And 4, an absence of global governance. And we recommend, 1, that we should plug the hole in global governance by establishing a global health threats board. Second, we recommend $75 billion over the next 5 years, $15 billion a year, to finance the gaps. And of this, $10 billion in a global health threats fund. That is $10 billion a year. So these are some of the measures just to make sure we can respond to the next pandemic. Then, Richard, for this pandemic, let me say the WTO, the IMF, the World Bank, and the WHO have joined to support the call by the IMF based on a study for $50 billion to be spent now to vaccinate up to 40% of the world's population this year, 60% next year. If we do that, we'll be able to contain and manage this pandemic, and we will add another $9 trillion to the world GDP by 2025.
Director General, I hear your numbers. You want your 50 billion and you'll get your trillions of future production, but you're not going to get that number. The difficulty we have at the moment is the rich countries have got all the vaccine. They're not giving enough money to help the poorer countries. The debt relief in the Paris Club, as you know only too well, is stalled. So I'm trying desperately not to be as pessimistic as I'm sounding, but it's not easy.
Richard, you're absolutely right. I mean, the current inequity we see is not acceptable by any stretch of the imagination. I mean, the good news is 1.1 billion more doses were produced in June, 45% higher than May. The bad news is that of this amount, only 1.4% went to Africa and 0.24% to low-income countries. So you're absolutely right. However, there's a dawning on everyone, including rich countries, including manufacturers, that it is in our own self-interest. It's in the self-interest of rich countries to support poor countries to get better access. So we are hoping that this dawning will lead to changes.
Let's talk briefly, if we may, before I let you go. Let's go to the more traditional work of the DG at the WTO. Any sign of any major improvement in free trade agreements? Is anybody interested in talking about them at the moment?
Well, let me tell you what members are interested in, and manufacturers of vaccines. The WTO is really playing a role in trying to make sure we get access to vaccines and trying to make sure we boost production. So members and manufacturers are interested in free trade. Why? Because any blockage of supply chains means we cannot scale up production. So actually, in the meeting we had today, there was a universal call for free trade, for free movement of goods and services with respect to vaccine manufacture. And the WTO is playing a very strong role in that.
Good to see you, Director General. As always, I appreciate your time tonight. Thank you.
Thank you, Richard.